One is asking you, only using the National Microbiology Reference Lab, how else are you going to vamp up with just that one place? We talked of our decentralization structure, where we're saying moving forward, we're not just going to test in Harare, we're also using the Bulawayo lab. You are aware we've been testing there now for 2 days. In other words, we got the equipment that NASA so graciously allowed us to use, moved it to Mpilo, the TB reference lab, set it up there, and they've started testing right away. Each of these are the PCR machines or equipment platform. Each of that type of platform can actually test 200 to 300 per day. We do not only talk of National Microbiology Reference Lab and the Bulawayo that has started, we also have other PCR machines here in Harare that can immediately start testing. You're talking of the University of Zimbabwe, you're talking of the ABST machine, you're talking of, I think we have one in, we're also looking at Gweru, Mutare, where they already have that equipment that we just need to support them a little. The key factor that was stopping us was because we didn't have the test kits and the reagents. Now that we have them, we're basically decentralizing, providing those laboratories to be able to start testing. We received 3,000 rapid test kits that we have already deployed to be used in provinces and so on. We have received test kits from, with support from WHO, CDC Africa. In addition to that, we also ordered some cartridges for machines that we already have in our districts. Most know that we treat TB, and we've got what they call the gene expert machines, and they're in every single district. But when we bought them to do TB testing, and hence we didn't get the cartridges to the COVID-19 infection. Remember, it never existed then. Now that it is there, the machine platform is designed to say you can actually then buy cartridges that fit into that machine to test COVID-19 disease. And that's exactly what we're doing. We've already placed the order. We're expecting to receive them anytime this week. So we use some modeling that has been done by experts to say by the end of this month, how many should Zimbabwe have really identified or confirmed as positive. And that model showed us that we should have identified about 1,000 positive cases. So working backwards, we say if we're supposed to identify so much, how many tests do we need to do that?